Good morning, Steve Stein, Chief Medical Officer here, back at the University of Kansas Health System, back with you live, and as I like to say in the Old West, back in the saddle again. That's my Broadway debut, but this is not a time for musicals because we're here to talk about COVID-19, and we have an all-star guest panel today. We welcome Mario Castro back into the studio. Mario is, I forgot some long title here. He is the Vice Chair of Clinical and Translational Researcher here at KU, so we're happy to have you back. Dr. Barbara Pahud is the Research Director of Pediatric Infectious Disease at Children's Mercy, and our good friend, who has feelings, I'm told, Dr. Lee Norman, is back today. I love to have Lee here. When I get to be here, we have a lot of fun together. So, and of course, he's Secretary of KDHE.
Yeah.
That's a lot of words, Hawkeye. So tell us how we're doing today.
Yeah, we're still holding steady, really. 22 active infections with 8 in the ICU and 3 on the ventilator. 12 in that recovery period, and Hays still has 1 active and 1 recovery as well. So our numbers really are not changing.
Yeah, I'd like to see it a little bit more change. But
we have a little bit more of a breakdown of some of our patients that we announced yesterday. The numbers haven't changed too much, but we did have 8 asymptomatic patients, so patients that had no symptoms whatsoever. Mostly were found on admission screening. Of those, 5 had no documented vaccination, 2 were fully vaccinated, and 1 was fully vaccinated, but that is an immunocompromised patient as well, so not unexpected. So overall, we did have 15 that had symptoms and are here for symptoms. 2 had the vaccine, first dose only. 1 had the Johnson & Johnson vaccine, and 2 actually refused the vaccine as well. One of those patients that was symptomatic and ill that refused the vaccine is immunocompromised also.
So in general, what we can say, it sounds like, is that you may, again, as the evidence will tell you, you can be positive after getting the vaccine.
Yeah.
Clearly, we have more that have not had the vaccine in that list.
Yeah.
There are a few that are hospitalized for COVID-19 who have been vaccinated, but we think that there's little question of how immunocompromised they are, and they may have only had 1 of the 2 shots.
Yeah, and it's really consistent with what we've seen from the CDC publication about the amount of people that have been vaccinated, and then that overall reduction in your chance of going to the hospital. And that's, again, a 90 to 95% reduction in that.
And you don't have serious, they're not critically ill either. The folks in the ICU, I don't think were any of the ones who have been vaccinated. Is that correct?
Yep.
So that, I think, once again, demonstrates that exactly what they saw in the trials, what we're seeing here. But we have to remember COVID-19 is a really, really bad disease. So, Dr. Norman, what's this about an increasing outbreak? Oh, we can't hear you. Is that a win or a loss? Try again.
We can hear it.
Can you hear me?
Now I can.
Now we can.
Hey, there's an uptick at long-term care facilities. What's up with that?
Yeah, it's staff members that are unvaccinated coming into the facility, and that's where the outbreaks are coming from. We've had very few of the residents get sick. It's been mostly exclusively in the unvaccinated staff members, which emphasizes the need for having them get vaccinated.
And talk to us a little bit about wastewater. What are you seeing as far as the variants now?
We're seeing, well, first off, we're doing a lot of testing. There's this organization called the Global Initiative on Sharing of Avian Influenza Data. Now, granted, COVID-19 isn't an influenza, but we're doing genomic sequencing, and we are the second highest percentage in this country in terms of all the states and territories in terms of submitting. We're seeing the same mix that we've seen before. We're seeing overall that the variants are making creeping ahead all the time in terms of how big the wedge of the pie is that is the variants, but it's the same mix. It's mostly the UK variant.
Okay. So big news rolling out of the CDC yesterday and out of the FDA about the Pfizer vaccine. Dr. Pahud, talk to us a little bit about that data around 12 to 15-year-olds.
Yeah, so it's the FDA approved this vaccine back on Tuesday, and yesterday the ACIP met. It was a unanimous vote to approve the vaccine except for 1 member who abstained. And that's obviously a show of support of how excited they are to bring this vaccine for teenagers. And when you can get it is obviously going to be dependent on each state is going to roll out the vaccine in different ways. we're hoping that it'll be available in multiple pharmacies and potentially even in pediatricians' offices. Children's Mercy is doing a clinic this Saturday starting in Children's Mercy, Kansas, and I think they're going to also roll it out at East. And of course, all that information is available at the Children's Mercy website, childrensmercy.org COVID vaccine.
And so that means that children will be vaccinating 12 to 15-year-olds or 12-year-olds, I guess, to 18, whatever, with Pfizer vaccine beginning this Saturday. Is that right?
If you can get it earlier, some people I've seen on Facebook are already getting it in some states. They were able to get it even Thursday before the ACIP vote came through, which I thought was funny. That as soon as the FDA approved it, some people were already giving it. We're supposed to wait until the ACIP recommends it, but some people are already getting it on the ground.
All right, Hawkeye, you have some young kids. What are they thinking?
Yeah, I mean, I think we may see some adolescents get vaccinated here.
That's an interesting. Are you trying to give a little bit of a prequel here?
Maybe a teaser. Again, I think, growing up, my parents were always, you just got vaccines. That's what you did. A lot of kids did, especially to go to public school. You had to have vaccines. As just raising the children, the adolescents, we know that it is important to, one, prevent them individually from getting those diseases that we don't see and don't even know about because they have really been preventable with the vaccine. So getting those vaccines has been really important. They are very good about it now. They understand every year, the influenza vaccine. They understand sometimes when they go to the doctor, if it's part of the schedule, they'll be getting vaccines. So they've really become accustomed to it and have kind of just, as we heard yesterday with all of our great pediatric guests, children are resilient. This is a really just a small drop in the bucket, but overall it's going to help them individually and also I think help the parents and help the family members, because if your children are well, if they're able to do participation in their activities and not be held out in quarantine and isolation, then that allows the parents to have a little bit more freedom to be able to go to work, not to stay home and watch their kids and all of that as well. So overall the kids are they knew this was coming, and I think they do try to get themselves psyched up for it, but I think it'll be a very positive thing.
So, Lee Norman, you're a young man. Now, do you have a 12 to 15-year-old, buddy?
No, but I do have I have an 11-year-old grandson.
There you go. So, what are you going to do? So, how is the state of Kansas ready to respond to vaccinating 12 to 15-year-olds, or actually 12 and above, with the Pfizer vaccine?
Yeah, I think that we'll be seeing in Kansas vaccination starting today. People were chomping at the bit, much as Dr. Pahud said. We did, as a state, held off until we got CDC approval, remembering they're the ones that provide oversight for vaccine administration and for the distribution, really. So we want to stay in good graces with the CDC and follow their advice. We have CVSs throughout the state that are doing, not necessarily every CVS pharmacy, and we're pushing out to a lot of school sites, mobile clinics. It's not the big mass vaccination clinics like we've seen earlier on during this immunization campaign, but it's a lot more in pediatrician, family physicians' offices, and certainly in schools. There's whole county, Shawnee County here is a good example, where all the schools had for the 16 and aboves, and there was a big uptake of vaccine in that population. So it's smaller, not big mass vaccination clinics, and we will assist the practices. More practices are signing on all the time, and I think it'll be even better yet when the Pfizer doses start coming out in smaller packaging units. It'll be easier for practices to deal with.
Yeah, you bet.
Yeah.
So those mobile units, are they going to be able to do kids 12 and over?
Yes.
Awesome. And how do you get a mobile unit to your site?
You can call our epidemiology hotline, and they'll put you through to the people. And we do it in very non-traditional areas. Matter of fact, we started one yesterday at a reservoir where there's a lot of people out there enjoying the good weather and fishing. And so we set up a mobile unit. We had National Guard soldiers. We have 6 trailers that are fully self-contained and temperature controlled and all that. So we're doing a lot of novel approaches to get in hard to reach populations, especially.
You really know how to handle a fishing trip or a flow trip. Like get a vaccine, go fishing. I like that.
Well, do it any way we can.
1-800-CALL Lee Norman for a good time. I like that. That's right there with the vaccine and fishing. Actually, that's a pretty good idea, by the way. All right. So, Dr. Pahud, with the addition of this vaccine to kids, how do we stagger these vaccinations for children now?
You don't. You just give whatever vaccine is due at the moment that it's due. So one of the news that came out of the ACIP yesterday is that you don't have to wait 2 weeks prior or 4 weeks after live vaccines, or whatever we do at the clinical trials is different from real life. So that was one very welcome news from pediatricians, and they actually modified the language yesterday on the spot as they were getting feedback that it's important to be able to give all vaccines for children at the same time. So it's up to the discretion, of course, of the physician and the parents, but the vaccine has the ability to be given together with all the other ones.
I like that. That would be a good way to go, I think. So let's turn now to a question about vaccine trials, Dr. Pahud, over at Children's that you've been helping lead. How far down can we go? When are we going to be starting to do 2-year-olds or 4-year-olds? What do you think?
We've been vaccinating the age group that we're taking care of right now, Children's Mercy, 6 months to 2. We're doing what's called the dose finding. So we're looking for the correct dose to move on to the large clinical trials so that we can do the clinical trials from 6 months to 11. And we're in the process of that right now.
Sure, Moderna, which vaccine do you think is going to be, are they all going to be available for kids soon enough?
Pfizer is going to probably reach first. But Pfizer is clearly the one that I think keeps moving ahead because they're not working with the government, as you know, in the adult trials. That gave them a little bit of speed, I think. They got their act together really quickly and they moved fast. And now they have maintained that speed and they are really doing everything really well. I'm really enjoying being part of that team. And by the way, Steve, you didn't ask me. I have a 12-year-old.
You do? Are they getting vaccinated or have they been vaccinated?
She's not going to get the Pfizer vaccine because she's in a Moderna clinical trial. And she actually chose to stay on the trial to contribute to the data for Moderna so that Moderna can get approval as well. So she could have gotten unblinded today and gotten the vaccine, and she's going to opt to stay in the trial because once the Moderna vaccine is approved, we're going to be offering, obviously, like we did in AstraZeneca, the kids are going to get offered vaccine in the trial. So if she got vaccine, she's done. If she got placebo, which is actually what I think she got, then she will be offered the vaccine through the trial, and she wants to stay on.
All right. Well, I hope that you get that answer very soon. Dr. Castro, how are things going on some of these trials that aren't and by the way, do you have a 12 to 15-year-old?
No, mine are much older.
So you're not as young as Dr. Norman then.
Yeah.
So talk to me a little bit about these other trials that are underway for outpatient therapies to help treat COVID-19.
Sure. Well, we're still actively enrolling into our outpatient COVID treatment trials. So these are patients that are out there in the community, not sick enough to end up in the hospital, and we're trying to figure out what the best answers are for them. We've just added a sixth treatment to that trial, and that sixth treatment is a mixture of monoclonal antibodies made by Bristol Myers Squibb, or BMS. And in that mixture, we're specifically targeting against the variants. So the monoclonal antibodies have this receptor binding domain that really helps us, by combining the two monoclonal antibodies, prevent the variants to cause further disease. And so by blocking the entry of that virus through that receptor binding domain, we hope that this will be advantageous for our patients that are starting to experience symptoms. The key thing is that you have to enter this treatment early. You can't wait too long. So we're looking at patients that are within the first week of symptoms, so first 7 days, and have to be within first 7 days of a diagnosis of a positive test. And on the screen is Christina Pantalunen's contact number, 588-3851. Reach out to her, and we'll be happy to enroll you in one of our trials. I think the fascinating thing by what we've seen is that as we move further, each one of these are going into actual treatment in our clinics here. So, as we learn more about them, this is really helping us curb this pandemic.
So one could say, please don't hesitate. Please reach out. Thank you, Dr. Castro.
Thank you.
Thank you. please don't wait. Get your antibodies before it's too late.
That's right.
All right. We're rolling this morning. Watch out. Watch out, folks. I'm not going to sing again, though. All right. So that's pretty exciting news. And just to say, people may not know everything or a lot about you, but you speak more than one language. And you have been talking to people about vaccines all around the world, especially in Spanish. Talk to us a little bit about how that experience has been.
Yeah, as we know, this pandemic has, here in the U.S., certainly disproportionately affected Hispanics, and so we need to get that message out to them because vaccine hesitancy is very high in that population, and so both Dr. Pahud and myself have been reaching out to our Hispanic community here in Kansas City, but also have reached out across the world, and we recently did a program in Guatemala with my colleague in infectious disease, Fernando Marino. And one of the things that many of us in the U.S. don't realize is this vaccine is not available around the world.
So talk a little bit about that. Yeah, let's hit that.
Yeah, well, in Guatemala, the vaccine rate was 0.1% of their population having at least one shot. And 0.1% is not going to get us very far around the world. And you can imagine when a country is already stretched thin in terms of their resources and not having access to the vaccine is a huge problem. And they don't even have access to protective equipment. I mean, they're desperate for protective equipment. So I think we need to do, as Dr. Pahud and myself have worked on the AstraZeneca vaccine, trying to get that approved here. Try to get it out to lower resource countries is going to, I think, help us in these countries because you'll be amazed. The CDC has a very nice website where you display by countries what the vaccine rate is, in the New York Times as well, and it's amazing. There's a direct correlation between not having a lot of resources and not having a very high vaccination rate.
Wow, I think we need a program devoted to this question because this is really a big deal, and I just wonder if what else can be done, because you see vaccine here, Dr. Norman, in the United States not getting used. Yeah. What's our supply now here in Kansas? I know we had a huge supply of people because of vaccines. We couldn't get enough arms to give it to.
Yeah, we have weeks of inventory in the state of Kansas and additional vaccine in the federal inventory that we could get delivered instantly. We've actually returned some vaccine to the federal pool to redistribute to those where the uptake is greater. We will not have any, even with an uptick of 12-year-old and older, we are not going to run out of any vaccine anytime soon. We've given 2.17 million doses, which is a pretty good effort. And about 1.2 of that is first doses, and about 900,000 are second doses. But we still are seeing a tailing off of the people that are getting the vaccine, particularly younger people, 20 to 45, we'll say. So that's a group we're really focusing on now to encourage that through marketing and community conversations and working with their physicians and care providers. Really important to get people they trust talking to them about it.
Okay, we've been able to get the vaccine into some of our offices, and I don't know if others are doing that as well, but do we think that that's helping?
It's real early. We hope it were. We were hoping it was going to, as people can talk with their primary care providers, really talk with a trusted person. We are hoping that not just in our health system, but around in other private clinics as well, that was going to be one avenue that we could help cure some of this vaccine hesitancy, really get it into arms. Just as you said, we are fortunate here. We know that other countries such as India, Guatemala, those places that are more heavy hit and don't have the resources, not even for vaccines, but for PPE, just as you said, we should be using our fortunate situation here, getting that is to many people as possible, because we know the way out of this pandemic is through vaccination. We know that the vaccination right now even provides probably better immunity to especially some of these variants that are circulating than does previous natural infection, especially, probably before the first of the year when it was more of just a wild type, simple coronavirus that was circulating compared to what is circulating right now.
Okay. So, Dr. Pahud or Mario or anybody, Do we think that we're going to be able to change the rules in the coming future? I know there's been Pfizer and Moderna both been trying to figure out if they can be stored at lower or at different temperatures for a longer period of times to make it easier to distribute. What do we see coming around that? Thoughts about that, Dr. Pahud?
Actually, somebody asked that question yesterday directly to the FDA and the ACIP, and the FDA said we cannot comment on that right now. So I think they're looking into it, but they have not given us any clue as recently as yesterday at 4 p.m.
Yeah. Any other thoughts, Dr. Norman, Dr. Mario, anybody?
Yeah, I had heard they were certainly working. We've already seen a change from the initial temperature and cold storage remarks and guidance, and I think it was in Pfizer now, to something what they have currently. So, and I think they are actually working on, the companies are, from what I've read, is working on more temperature stable types of things.
Dr. Norman, thoughts?
Yeah, that it's going to be really important because that's been an obstacle to getting this into doctors' offices and into clinics. Smaller vials, single dose syringes, and easier to manage from a temperature perspective would certainly benefit us a lot. And the White House and General Perna, who's running Operation Warp Speed, is not making any promises about any of those things that I just said. But that I think ultimately we'll be getting boosters and I think single dose syringes, but we're just not there yet. That would be a real breakthrough if we could do that.
Yeah, that'd be great. All right, so let's see if there's any questions from reporters. I know Dr. Norman has a hard stop at 8:30. I don't want to hog it all. Actually, I do, but we should first see if there's questions from reporters. I'm not hearing any, so let's turn to Jill. Let's see what questions are out there in the public. Oh, there is one. Sorry. Go ahead.
Hi. Hi, John Hayes with Cake News here. Question is for Dr. Norman. Doctor, with just kind of this rollout of vaccinations for 12 to 15-year-olds, how does the state think that'll factor into vaccination hesitancy? I know you just mentioned that we're having a hard time now prioritizing these 20 to 45-year-olds and getting them back. What is adding this age group going to do in terms of parents that were already kind of hesitant and putting more people out to possibly getting this shot?
Yeah, real good question. What will be the overall impact? And it's a little bit too soon to know. We got a little peek at that with 16 to 18-year-olds. We had parents that would give consent for their 16 to 18-year-olds to get the vaccine, even when the parents themselves have not. We had some parents would come in and actually get the immunization at the same time their 16 to 18-year-olds would get them. And we're encouraging vaccinating sites, and even pediatricians' offices are doing this, and I think it's a really smart thing to do when the kids come in, whether 16 to 18 or 12 to 18. If the parents say, yeah, I'd like to get the vaccine, they're giving it to the parents too. So I'm hoping that it'll bring up a whole new window that people see through the need to get it, vaccinate the children. So I hope that'll bring parents as well.
Yeah, and just kind of the overall impact that this could have going forward. I know that's kind of hard to grasp at this point, but we have schools that are returning, kids are returning to the classroom. A lot of people may think, oh, kids don't necessarily need this vaccine. They aren't at high risk of major hospitalization or even death, but just kind of touch on the impact this could have in terms of getting back to normal life down the road.
I think it's going to be a big impact. You know, both in terms of getting kids in person in schools. Many schools are already having in-person classes, of course. Ultimately, and I can't tell you when that will be, but distancing and mask wearing will become a little less critical. And we're especially seeing it where it impacts on athletics, because then if somebody's vaccinated, then they have a close contact with it and are asymptomatic, they don't need to quarantine. And that's true of traveling to other states as well. So coming into the summertime, a lot of parents are reluctant to send their kids to the normal summer camps and summer activities. And I think that a fully vaccinated kid will have many more avenues available to them. And it would be nice to use the vaccine as a way to get back to more normal activities without having to be quarantined when they are exposed to cases.
All right, other questions?
Yeah, and last question for me, and then I'll let you guys wrap up.
We're not hearing you.
I think we lost him, so I'll
think
have
we
one
did.
for Dr. Norman, and perhaps the reporter will join us
Go
again.
for it.
Joanne says, in my hometown, Dr. Norman, there is a high school student suing the high school for requiring him to wear a mask. Dr. Norman, do you see more cases like this coming up, and what do you think?
I think there is that option. There's a number of lawsuits in the state as it relates to mask wearing and other kinds of anti-contagion efforts. I think that they're pretty ill-founded because we've been talking about the principles all along of distancing and mask wearing and the like. And I think it's really unfortunate that it has become so divisive, has led to lawsuits. I think it would be awfully hard to show that a person was harmed by wearing a mask.
You've not been harmed. You're going to be benefited by wearing a mask. And again, we demonstrate that every single day in hospitals across the United States and across the world, that wearing a mask prevents disease.
Yeah, and vaccination, masking, distancing, we know these things prevent disease. I think there continues to be a lot of myopic views out there, a lot of narratives that are created so it can match people's conclusions. Unfortunately, it continues to happen, but we will continue to certainly endorse doing those proper things, those non-pharmaceutical interventions, but of course vaccination as well.
Yeah, gosh darn it, when none of your employees in a major health system like ours, which had up to 250 COVID positive patients at any one time, when those employees were not getting sick by taking care of them because of mask wearing and infection control, the principles work and you're not harmed. You're only really benefited by it, and it's a simple act of love. It's not an act of hate. And to say I'm not going to wear a mask means, well, what is my level of caring for the people around me by doing that? I don't understand that.
Okay, Taylor with 41 is trying to get a question in. Taylor, I think that we have addressed it. See, can you ask your question?
Hi, guys. Good morning. I think I was muted the first time.
Taylor.
Excellent.
We apologize.
Sorry, a couple questions.
All right, go
No,
for
it's
it.
okay. I was like, well, if they're trying to tell me something, I finally learned it.
No, you're one of our long
I had a couple of
haulers.
questions I wanted to get. We were saying this morning that we got numbers from Missouri of how many actually fit into that 12 to 15 age group. In the state, it was like 330,000, but we didn't have that number from Kansas. I'm wondering if Dr. Norman has even an approximation of how many fit into that 12 to 15 age group in Kansas. The second question I had about was, I was thinking about chicken pox, which is typically a kids type disease, and if there's any concern for parents whose kids have not had chicken pox or had it recently with the vaccine. And then I also wanted to see if there's, I know we said that kids can get it dose 1 and dose 2 in different states because of summer travel now, and I wanted to see if, I hadn't heard that was the case for adults now. I wanted to see if that was also the case now if we're traveling, if we can get 1 in Kansas and 1 in a state where we're traveling. Thanks.
Steve, I can answer number 1.
Go.
Yes, 160,000. 12 to 15-year-olds, 160,000 in the state of Kansas. And question number 3, and the answer to that is yes. We don't care what state a person's from. We'll give them the prime dose or booster dose.
Yeah, and I think that's loosened up across the United States, hasn't it?
Yeah,
To the best of my
state.
knowledge. Yep. Dr. Pahud, what do you think about this question of chickenpox and COVID?
So I'm not sure what they mean by that. So I think they're referring to the fact that in adults, some people get the COVID vaccine and they may have zoster reactivation. I'm wondering if that's what the reporter is alluding to. But chickenpox vaccine is given at 1 year of age, and then the booster is at 5 years of age. And we're talking right now about COVID vaccine approved for children 12 and above. So I'm not quite sure what the question was. If you can clarify better, I'd be happy to.
Dr. Pahud, it's Taylor. I was thinking about ailments that are typically more associated with children, and chickenpox is one that I think of. And if your child hasn't had chickenpox yet, potentially, or just had chickenpox maybe in the last 6 months or so, and it's time for their vaccine, I'm just making sure there's no fear of any problems there.
Okay, so then I'll answer it this way. Your child should not have chickenpox because we have a perfectly good vaccine against chickenpox that hopefully your child will get. So if your child has not had chickenpox, go get them their vaccine. And if they have their vaccine, they will not get chickenpox. And if they do have chickenpox because they were not vaccinated, wait until they're better and then you can get them their COVID vaccine.
Being the COVID-19 and the chickenpox vaccine close together, Dr. Pahud?
You can give them at the same time if you want to, but again, chickenpox vaccine is administered at age 1. and 5. And we don't have approval yet for COVID vaccines down to that age group. So that question is not quite there yet. I do think once we get this vaccine ready for the little ones, which we're very close, it's probably going to be September, October of this year. Those questions are going to come up. Are we going to allow to give COVID vaccine at the same time as live vaccines? I'm anticipating it's not going to be a problem, but we will see what the ACIP votes. But that is not an issue right now since those vaccines are not given close together.
Okay.
Okay, we need to let Dr. Norman go, but the other doctors need to stay because I have questions for them, including Dr. Castro.
All right, Dr. Norman, as always, thank you for your service. Thank you for being such a great friend to the state and to this health system and to every health system across our great state, and thanks for all your great work.
Thank you. I might add one more comment. If you want to go crappie fishing at Lake Melbourne in Osage County, below the spillway, that's where the mobile vaccination clinic is. So you can go catch some crappies and get a vaccine at the same time.
I like that plan already. All right. Thank you for the fishing tip and the vaccine tip.
Okay, we have 5 or 6 questions, and we're going to rock right through them. And I'm going to start with Anil, Hi,
Anil.
Hi, Anil. He wants to know, can we start making appointments to vaccinate our 14-year-olds today in Kansas City?
I think the answer to that question is yes. It sure sounds like from Dr. Pahud that's a yes. I see her head going up and down. Yep.
Yes. So if you go again to the Children's Mercy website, which again I'll read out to you again, childrensmercy.org/COVID-19. I think that's it. You can Google it. You'll find it. There's a list of all the clinics, how to schedule. You can schedule through the patient portal. There's a phone number as well, 816-302-6300, and vaccines are available for ages 12 through 22 at Children's Mercy, and we have clinics starting Saturday, but we have them all next week as well, Monday, Wednesday. So yes, they're definitely available, and there's links on that website as well to see other sites throughout Kansas and Missouri.
And the right URL, Dr. Pahud, according to Lisa Augustine, who's my counterpart over at Children's Mercy, is childrensmercy.org/COVID-vaccine.
Yeah.
So we will try to get
I bet if you Google Children's Mercy COVID vaccine, you're going to get there. So without all the special characters, just do the Google search. And in the meantime, you'll be doing it. I know we're going to be giving him as well. So
that's it.
All right.
Yeah, and I think, check with your local county health department as well. And I'm sure you could go to the KDHE Vaccine Finder. There's a lot of vaccine finder websites now from the CDC and with the local health department. So I would check there as well.
As well as your local pharmacy. Because
we have Pfizer too, I
We have
believe.
Pfizer as well. Yep,
So go to my chart if you're a patient or whatever. Start that process. All right. Connor wants to know, can we please have an update on recruitment numbers for the inhaled interferon arm of Active 2?
All right.
Yeah, so the Active 2, we have enrolled over 40 patients in that study here. Of those, there are about a half a dozen that have been enrolled into the inhaled interferon arm. That is available for patients with mild outpatient COVID infection. It's one of the few that we do. Most of the infusions and injections we're reserving for the more severe cases, but that inhaled interferon we're definitely using in even mild cases. And I think it's going to be exciting to find out because it would be potentially a treatment that you can do in your home with a nebulizer.
And is that a one-time treatment? I'm sorry.
For 14 days.
For 14 days.
Yeah,
Once a day, 14 days, and then interferon's safe to others around you, unlike, say, ribavirin or something. So
yeah, so there's no adverse consequences from it being nebulized in the air in terms of the interferon. So it is a special nebulizer. It's not a regular nebulizer like you and I use in our practice, but it is a special delivered breath-activated nebulizer that doesn't really get much of the medication into the environment.
And then, do you have an idea of how soon you think that trial will be completed?
So the way we're doing it is that we'll be completing its phase 2. We anticipate that in the next few weeks. So that's 110 enrolled around the U.S. That will then be reviewed by the Data Safety Monitoring Board, by the FDA, and then they'll make a decision to go to phase 3, which will be 1,000 patients. So
okay. It's going to be a while, though.
It'll be a while before we get to that point. And again, contact Christina, if you'd like to come into that, because that will really get us faster there if we can get more patients in.
And just to clarify too, interferon has been used before, such as hepatitis C treatment. It's nothing new. It is a cytokine that your body creates in that immune response. And it is one of the things that the virus uses in that initial stage of infection to help evade the immune system. So you're hopefully adding this on at a sooner point than it would normally naturally be happening to help that immune system ramp up a little bit quicker. So.
We have a sports physician that is concerned about that the vaccine for the children is EUA and wants to know, would you go ahead and give it to your kid under emergency use authorization, or would you wait for full approval? Why or why not?
Right, you bet. I'll just say that the vaccines that have been given in the United States for COVID-19 are all under an EUA right now. Although I think Pfizer is going to go to the FDA, or has gone to the FDA now for full approval, and Moderna will be on their heels. And so I think we'll have a fully approved vaccine in the near future. But until that time, we're all under that same EUA. My answer to that question would be yes. All three of my kids have been vaccinated under the EUA. My children, though, are 31 and 29 and 25. So, but for younger kids, you've already talked.
Yeah, absolutely. You know, just our anecdotal experience here at the health system, we know that last year we had a high school football player who had multi-system inflammatory disease. There was no vaccine available at that time. We know that the vaccines will help prevent that whole spectrum of disease, and will likely also prevent your child's chance of getting multi-system inflammatory disease as well. I think it is going to be very helpful. And again, keeping your children in doing those participation, whether it's sports or band or whatever, or going to camps or traveling, whatever that may be. I think overall the simple answer is yes. They are going to get it as soon as it's available.
And Dr. Pahud, you said your 12-year-old has already been in a trial here, or at Children's.
She's in a trial, and to be honest with you, I was very torn because I actually want her to get the Pfizer vaccine. If it was up to me, I would pull her from the trial and give it to her. But apparently she understands clinical trials better than I do, because she's trying to keep the data, uncompromised in Moderna. But if it were up to me, I would be giving her the vaccine today. And now I'm going to have to wait until the Moderna one comes out so she can get it that way. But I have zero concerns about giving a vaccine that's under emergency use authorization. We have, especially for Pfizer, if you think about it, this vaccine has already been approved for children 16 and above. We have over 1 billion doses of vaccines, a mixed bag, of course, but 1 billion doses of COVID vaccines have been given around the world by now. We have sufficient data to know what the rare side effects are, the common ones, and we have data in 16 and 17-year-olds. So now we just brought it down to 12. And then we're going to have data from those 12-year-olds and above from the public, millions of doses being administered, as opposed to a clinical trial that is limited to 20, 30,000. So this is not just clinical trial data. It's a real-world data that we have of how safe this vaccine is.
And I think that's a great point. 1 billion doses around the world. When we've approved, whether it's Shingrix or any other vaccine in the past, we never had those kind of numbers. We have so many more numbers now to know that it's safe. It's just a process question that it hasn't been approved. It's going to be approved. The question is, how many doses have you get? 1 billion. How many doses did Shingrix have? I promise you it wasn't 1 billion.
Yeah, and that's part of the issue that this is, Mario and I understand this really well. We've done clinical trials in the past. We are used to vaccines halting, stopping, the data being reviewed. That happens always in clinical trials. It's now happening in front of the news. So people get concerned when they're like, oh, we're going to stop giving Janssen & Janssen because of the clots or this. That's exactly how you know that the vaccine safety mechanisms are working, because a rare adverse event can only be found when you start giving the vaccine to millions of people. If this vaccine adverse event like anaphylaxis or like clotting happens in 1 in a million, how are you going to find it in a clinical trial of 30,000? You can only find it when it becomes available for the public. And the right thing to do is to be transparent about these side effects. And that's exactly what we've been doing. So I understand it's scary to hear about these things, but this is the correct way to do it. We're telling you what's happening in real time so you can make an informed decision.
And it's been happening forever. And so, Dr. Castro, I assume you would be comfortable giving it, although your children are no longer adolescent, I understand. It's that great beard that gives that away. Sorry.
No, I think, the Pfizer data was just amazing. 0 cases in those that got vaccinated of those adolescents. And And so, of course, it's not going to be zero as it goes out into the public, but it is very protective. And when we talk about trying to get back into normality, this is the way to do it. And our kids need it. They need the socialization. They need to get back to, being with their friends. This has really, unfortunately, changed our education system and changed our society. And so we need to get back to that normalcy, and this is the only way forward.
Okay, Kate and Joyce, I'm going to put their questions together. Kate has a 13-year-old who is much smaller in age and development, height, everything, than her age. Her mom thinks she's more like an 11-year-old, so she worries, is it okay for her to get the vaccine? And then Joyce is wanting to know about multiple severe allergies to things like peanut butter and that kind of thing.
Okay, let's take these on. What do you think about the person who's smaller or feels younger than their actual chronological age?
It happens, but that happens in adults as well. I mean, we all have seen grandmas that are probably like 70 pounds and they're like tiny, and we give them adult doses of medications and vaccines and all these things. So when we do the clinical trials, we take these things into consideration. And remember, we're already testing the vaccine for children down to 6 months. I mean, the Pfizer vaccine, I have it in my hospital right now. We just dosed yesterday. We are giving it to babies. So yes, absolutely, I would be okay with giving the vaccine. Now, as with everything, maybe she'll have more of a sore arm, but the protection is really what we're after. And if she is old enough to get it, I would give it. And in terms of allergies, there's no contraindications to getting the vaccine if you have peanut allergies, egg allergies. It's only if you have an allergy to one of the components that's inside of the vaccine. The PEG, as you know, is what we were more concerned about causing anaphylaxis. If you don't know what PEG is, it means you're not allergic to it.
All right, one question more, and then the rest we'll put in tomorrow for Follow Friday. Sean says, Dr. Castro, will we ever get to the point where there will be an over-the-counter treatment for COVID, like, Tamiflu?
Sure. Well, even Tamiflu is a prescription, so at this point. I do think that we're very interested in, are there potentially over-the-counter treatments? Certainly, there have been vitamins, supplements that have been tested. To this point, none of them have been shown to be effective. And I think at this point, it's going to be far down the road before we get to any over-the-counter supplements, because we just need that safety data, with those medications. And I think ultimately, though, we want something that is easy to administer through a primary care physician's office, and hopefully that will either be an injection or an oral medication that can be delivered in that primary care office setting. But I don't anticipate that will be anytime soon before we get something over the counter.
Okay.
Yeah.
All right. Dr. Pahud, I hear you're trying to say something. Go ahead. You're on mute there for a second.
I was just going to see it's going to be Dr. Castro's over-the-counter magical pill.
Yeah, I like that. Mario's magic pill. I think that's the one right there. Hey, so you've already heard tomorrow we're going to be doing our follow-up Friday, and please join us. We'll help answer questions. Amanda Cackler will be here with us, our Director of Quality and Safety here in the hospital and our health system, and of course, Hawkeye and I. Hey, let's get final thoughts today. First, Dr. Pahud.
I am very excited, as were many pediatricians across the country, that we have this luxury of living in this country where we have access to vaccines for our children, where Mario just said, most of us who are paying attention to what's happening around the world, it's really sad that many countries don't have access to vaccines, not even for their adults. You've all seen the situation that happened in Mexico, in India, in Latin America, and many countries where there's not even enough oxygen to treat patients that have COVID, and they don't have access to the vaccines that we have. And now we even are giving vaccines to our children where other places can't even give them to adults. So it is really sad that we live in a country that is so used to having everything that now we're even turning to declining vaccines and thinking that this is optional, where everywhere else in the world this is a luxury. So I wish people would think about this again, get the information you need to make a decision, but we have vaccines, we should get them, and it's clearly having an impact in bringing down cases. So I urge everybody to get yourself vaccinated and your children.
Thank you, and thanks again for all the great work you've done. Thanks for being a part of this program. Dr. Castro.
Well, one thing we haven't really mentioned is what are the consequences of having a natural COVID infection, and they're huge. We're hopefully going to be hearing from the National Institutes of Health on a trial that we'll be rolling out here on how to understand better the sequelae of COVID and the impact that has on our brain, our hearts, our lungs, our muscles, and our energy. And that's huge. It's contributing to a lot of disability out there in my patients and our lawn hauler COVID clinic or post-COVID clinic. It's filling up. And so really, when you think about judging this for your child or for yourself in terms of the vaccine, not only think about the protection that it's given, but also the prevention of long-term consequences. Because if that happens to you, it will impact you the rest of your life.
Yeah, I think that's exactly right. I was going to go there, and you've done it, and that's been perfect because we've needed to get that message across that COVID-19 isn't just about the here and now, it's about the longer term. Dr. Pahud, I see you waving, or was that a question or state?
Yeah, one last statement. We're also going to start a new study, a randomized control study to assess SARS-CoV-2 infection, viral shedding, and potential transmission in individuals that are either immunized or not immunized. So this is for adults 18 to 26. We have a registry in that same website that we read out where you can sign up for the vaccine clinics. All the way at the bottom is the registry for participating in COVID trials. If you're interested in participating, if you don't want to get vaccinated and you still want to help science, sign up, we'll call you and we'll get you all the way at the bottom. If you scroll up, you'll see that there's a section that says, there it is, the registry research survey. That's the one. And if you fill that up, we can call you. And if you're still hesitant about vaccination, but you still want to help, this is a way of helping.
All right, Dr. Hawk.
Yeah, I'll just echo the two comments from our guests. You know, in regards to Dr. Castro, it's not only those problems you develop with acute COVID. People can develop problems even weeks later, up to 4 weeks or more later. They can develop a new problem they never even had with the acute illness. But also certainly echo the excitement that we have now for the vaccination of those younger populations. And hopefully everybody will continue to do that, keep individually them safe, and keep our community safe that way.
All right, folks. Hey, thanks. This has been the best program. I love these people when they're on. This is why I love them anyway. But I'm just saying, this is such a great program. You guys are here. And thanks. Please come back all the time. And makes our job so darn easy. So you've heard the message out there, folks. You know, please don't hesitate. Please don't wait. Vaccine and antibodies before it's too late. We'll see you tomorrow.